Good morning, good afternoon, good evening, depending on what time you're watching this podcast. Thank you for entering into this space again. This is Race, Culture, in the Church. Race, Culture, in the Church. And I am pleased, I am extremely honored that today's guest that has entered into our four walls of what we call City Church of Sacramento is Dr. Olivia Kasirye, MD, Sacramento County Public Health Officer. Welcome.
Thank you.
Thank you for being
me.
here. It's a tremendous honor. I know you're extremely busy, and I really sincerely appreciate you being here. Did a little research, not exhaustive. But that research is comprised of pulling information off the internet, and it said, and stop me at any point it's incorrect, you're the public health officer since 2012.
That's correct, yes.
10 years anniversary
10 years,
in February,
yes.
I think it was.
Yes.
Oh, wow. That's, I'll say more about that in a second. Mm-hmm. But prior to this, you were the public health officer for El Dorado County, the medical director of Sacramento County's Child Health and Disability Prevention Program, its maternal, child, and adolescent health program, and communicable disease controller. Boy, that's a lot. Just right there, that's a lot. And an aspect of your formal education is that you obtained your master's degree in epidemiology from UC Davis.
That's correct, yes.
Now, I'm not a doctor, and I don't pretend to be one either. But it sounds like you are uniquely qualified for the position of public health officer, that your whole path, your whole journey has prepared you to be in the position you're in for Sacramento County for the last 10 years.
Yes, I strongly believe that God's hand was on my life from the beginning, even at times when I didn't know where it was going to turn, doing different things, even coming to the United States. Looking back now, I just see that God was just preparing me at every step of the way, giving me opportunities to learn different things, meet different people, until I got to this point.
As I like to say or remind people, when you're in the middle of the forest, you can become, just kind of lost in the forest. But when you step out of the forest, you can kind of look back and appreciate the path that you've navigated, that you took to get to this point. Did you know at a young age that this is where I'm being called? This is the gravitational pull, if you will, to maybe not, at 10. Young Dr. Olivia didn't know I was going to be the Sacramento County Public Health Officer, but I knew that I was going this way.
Well, it's a lot of that was driven by interests. As a young child, I had a lot of interest in biological sciences. My parents put a lot of effort into exposing us to different things, especially through books. We were encouraged to read all kinds of books, encyclopedias, Reader's Digest. And I think what I really liked about the Reader's Digest was stories about different people, and sometimes stories about women who had done great things. And that piqued my interest in saying, I'd like to be one of those. So as I grew older and had to make choices in terms of careers, of course, with the advice of my parents, I decided to go into medicine and found that I was very interested in areas like public health. Initially, I didn't think of going into public health. I thought I'd be a clinician somewhere. But having the opportunity to come to the U.S., I saw more of what public health could do. And when the opportunity came up, I felt like, yes, this is the direction I wanted to go in. Also, of course, strengthened by the opportunity to do a master's in epidemiology, and that really opened my mind up to, being able to analyze data. And one thing that actually stuck with me was one time we were asked to do a study about, we were actually asked, just do a study on any population you choose. So I said, okay, I'm a Black woman. I will do a study on the health disparities or health impacts among African American women. And I was really shocked that every single disease I looked at, there was this huge disparity. And I said, that's just amazing. And that actually also helped me to make decisions as to what direction I was going in. I feel that being able to solve health disparities is really important.
That just speaks volumes about who you are. Just what you just shared, and the fact that you chose a path, a public service path, versus a private clinical path. I'm sure you do well. I'm sure Sacramento County pays you a nice wage. We pay you a nice wage, but it can't compare to what you could have received had you gone a different path. That just speaks about, to me, again, maybe it's just the engineer in me, when I hear things like that, it's like, oh, okay, I see where your heart is. I see what's, again, I keep using the term, the gravitational pull. Public service. Service for women of color. When I see the data, when I see the data, you have one or two choices. Well, that's too bad. I wish it were different. Or I see the data. Let me see what I can do about that. What role can I play in that? I appreciate that. With that PSA, you've been pulled in this direction. Tell me, so I don't assume, what exactly is the role and responsibility of the county public health officer?
Well, the simplest way I can put it is when you go to your private doctor, your doctor takes care of you, does certain tests, and makes sure you're healthy, gives you advice, gives you medication if you need it, and basically makes sure that you're healthy. Well, in public health, our role, instead of having the individual patient, is the entire community. So there were times when I'd tell people I'm a health officer, and they're like, what's that? Are you a real doctor? Do you have patients? And so eventually I just started saying, yes, I do have patients. I have 1.4 million.
Correct.
Which is the entire Sacramento. So my charge is to analyze the data that comes into us through different sources, to find out what the issues are in the community, health issues, and to either find solutions or work with others to find solutions. Sometimes that involves providing direct services. There are some direct services we provide. And sometimes it's just being able to give the information out. And I think especially with the COVID pandemic, all of that came into play because we were getting the information about COVID. We had to tell the public this is what is going on, whether it was low risk, high risk, and also what did they need to do in order to keep themselves safe. And then being able to provide testing, being able to provide vaccinations, being able to work with community-based agencies. And I appreciate your church for agreeing to provide vaccinations, but all of that is important, and all of that is what we do in public health.
So, as you were speaking, I'm writing. It's okay. So I'm a single word kind of guy. So you're a doctor, clinician, you're a politician, you're a cheerleader, You're an advocate, fundraiser. Am I missing any other? It just, again, I joke, but I'm not. It's the space you stepped into, like poll workers and the registrar of voters. 10 years ago, dare I say, your responsibilities not only looked different because COVID wasn't a thing, but the whole space was different 10 years ago.
Yep.
Now you're in space that no one, I mean, maybe you anticipated this looking back in the early 1900s. It's like, okay, we're coming up on a century, and now maybe we're going to have another pandemic. That had to be part of your research or your studies, and maybe we're due. Well, lo and behold, about 100 years later, you're into this space. Now, you're those things, and then also you. Let's put it this way: how do you maintain your mental, spiritual, physical health and stability? This has got to be the weirdest space. I can't imagine what that's like. It doesn't.
Yeah.
You're more than a pastor. Let's just put it that way.
Oh no, I think pastors have a special role, but
and Dr. Kasirye doesn't.
I do have a role as well.
A special role.
A special role. That's true. Prior to COVID, the kind of things we used to do, it was more behind the scenes, and a lot of people. That's why I said that. Sometimes when I said I was health officer, they were like, "What's that?" But COVID-19 just kind of really threw us into the limelight, to the forefront. Of course, as you've mentioned, it's been a century since the last large pandemic, and we knew that something would happen. We were preparing for it. But of course, in your mind, you're always thinking it won't be me. And of course, we had situations like when we had the Ebola and we had H1N1, and we did well, and we thought, okay, we've got this. I don't know that even with all of our preparation, any of us really anticipated that it would be to this level and extent. And so we had to pull from everything, not just what we already knew, but also being able to adapt and look at different things that we didn't even expect to do. For example, I never thought that I would have to issue an order for the entire county to go on lockdown, even though I knew that in the law I had that authority, even though in our preparations, because we do these and we have exercises, we had talked about what would we do if we had to quarantine a large group of people, but we always thought it would be maybe a few households, which is what we dealt with in like the avian flu. But as we saw what was happening in across the oceans in Europe, in Asia, and nervously looking at, okay, are we ready for this? And then when we started seeing cases locally and knew that it was beyond the control measures that we had, we knew that we had to do something bigger. And so I depended on a lot of things. One, of course, is support from the staff. We really gelled and worked very closely together, and for long hours too. My family was also very supportive, but I also appreciate the support from the community. So many times when I'd get discouraged, I'd get a message from someone saying, "We see what you're doing. Thank you. We're behind you. We support you." And then, of course, my faith in God as well, in, just asking for guidance, for wisdom.
Well, let me, I'll say thank you at the end, but let me say on behalf of Mark Meeks and his household in City Church, I so thank you for all that you've done, continue to do and will do. And we do pray for you in your role
Thank
and your
you.
position. It's an incredible lift. Okay, let me just say this. The Sacramento Observer named you Person of the Year for 2021. Person of the Year. That's a big deal. That's a huge deal. The article said leaders are often judged by how well they do in a crisis. So would you characterize the last 2.5 years as a crisis?
Oh, absolutely. Beyond anything any of us had expected to deal with. A huge crisis, and we knew we had to rise to the occasion because we knew what was at stake. We were seeing how devastated families could be by COVID-19, and we had to do the best that we could.
So would you say of this crisis, if you could ascribe, and I'm not looking for any specific percentages, was the crisis, it's got to be both, and it's more than two, was it the disease or all the ancillary things?
It was everything. The disease itself, of course, was frightening because when you'd hear people describe, difficulty in breathing and people dying suddenly. But it was also all the other things we had to deal with. For example, again, as I mentioned, as we had to order the shutdown of all businesses, people would call us crying, saying, my business, I've worked for 20 years and I'm going bankrupt. That's not easy to deal with. But also people who had been exposed and didn't know if they had the disease, and they'd call us and they just wanted to talk so that they could get some comfort, having to talk with them as well, having to work with our staff as well to make sure that they were okay. So it was a huge burden. And then also, of course, because unfortunately this became politicized, having to deal with that vitriol from people who are angry and others who didn't believe that COVID was a thing, didn't believe in vaccines. And they directed all that vitriol at us. And, we had to keep standing because we had to be there in order to provide the services.
Need to add counselor to the list of adjectives that I'm get one of those, what do you call those wordles or whatever, those things, those word diagrams. It's like based on the percentage of time. You might do this for just for kicks.
I'll try.
It's like, okay, what am I today? Am I a counselor? Am I an advocate? Am I a finance? Am I a budget analyst? So
That's true.
it is a tremendous responsibility. And I don't think there's any schooling that could have prepared you for what you had to face.
Like I said, we do the preparation, but then there comes a time when you have to answer the call. And that's what we needed to do. And it took everything. It was more than what we expected, but we also knew what we needed to do.
Well, the data that I was able to scrape, and it wasn't the easiest data to get. I thought again, we've hosted clinics, and I thought I'd be able to pull real-time data. So please, doctor, correct me if this is incorrect. For California, I see, as of this morning, when I looked, fully vaccinated, 75% statewide. African Americans, 58%. Does that sound about right?
Yes, it does sound right. Yes.
Sacramento County, fully vaccinated, 84%?
I think that's actually people who have gotten at least one dose.
Okay, so not fully vaccinated. Okay, so I'm guessing then we're probably tracking closer to the statewide average.
Yes.
Okay. African Americans in Sacramento County, 48%?
Yep.
Why the disparity? Access? Fear?
It's
What?
And that's one thing about public health is a lot of the issues we deal with have a lot of factors. And I think it came across very clearly during COVID. Why were African Americans at higher risk of infection? Why were they at higher risk of severe disease? And why do they have lower vaccine rates? Part of it is due to the unfortunate history that we have between the medical system and the African American communities, where the African Americans don't always get the best care, don't always have the access, and oftentimes even when they have the access, they sometimes it's late. And then also it depends on the kinds of occupations they're in. So when you look at COVID-19, for example, why were African Americans at higher risk? One of that is because many of them are in service industries where they had to continue to work even when others were able to telecommute. And so they still had that exposure. They still had to deal with the public. And so that ongoing exposure was there. And then why were they at higher risk for severe disease? The diabetes, the hypertension, the obesity. And there are a lot of reasons why we have higher rates in the African American community. Some of that is due to lack of access. Some of it is due to nutrition. Some of it is due to the environment, where you have somebody who doesn't even have any grocery stores that they can easily get to. They have to get on 3 buses in order to go to a grocery store where they can get fresh food. All of those are factors that come into play. And then with the vaccination, when we rolled out the vaccinations initially, it was based on occupation. And which occupations did we start with? Doctors, law enforcement, teachers. And in all of those, the underrepresentation of African Americans. And so all of those came into play. And then as we started reaching out, I think there's that lack of trust that has developed over the years because of, the unfortunate history of the African American communities. And it's something that we've had to work on. And so being able to work with community-based agencies that already have that trust is what has helped us to even get to 58%, because we started off in the 20s. So we still have a ways to go, but we've also made a lot of progress.
Well, you're many decades removed from Uganda, your home, your birth home. So it may be an unfair question, but I'm going to ask anyway. Does the African American response correlate? Is it similar to the African response to vaccination and information? Is there a there?
I think there's some similarities, but there are a lot of differences as well. One thing you'll find is that like if I'm in Uganda, when a doctor speaks, it's like everybody just does what that doctor is telling them to do. We don't have a lack of trust about vaccinations, except, of course, now with TikTok coming in and providing all kinds of misinformation. Right. But in general, that trust is there. And
so if access and information, all things being held similar and stable, access and information, the history, the social fabric of the community in Africa, there's more of a, as you said, trust that, well, the doctors have my best interest at heart. I'm going to respond.
That's true. Yeah. And so that's something that we need to work on as we are working on recovering from COVID-19. I think this has really highlighted areas where the disparities are coming from and what we need. We know what we need to do. We just need the resources and the time.
Doctor, you just said a mouthful there. You said we know what we need to do. Do we? I mean, you wouldn't have said it if you didn't believe that. So, do we know what we need to do?
It's actually working with the communities and developing that trust, and that takes time. That takes resources. Like I mentioned, for example, when we were rolling out the vaccine, and we started going into the communities that are often described as hard to reach. If we did not have the community-based agencies working with us, we would have had very few people coming up for the vaccinations.
I know it's anecdotal. I'll just throw this out there. I'll never forget, I was at Wellspring Women's Center, and with my little clipboard or little piece of paper, and I'm just literally going person to person. Do you want to sign up? Do you want, can I get some basic information? Here's a time. Come in, get vaccinated. Women of color, highest risk, couch surfing, living on the streets. One lady in particular, I said, have you been vaccinated? No. Would you like to be vaccinated? Her response to me was, are you trying to kill me? It's like, why would I do that? No, I'm not interested in being vaccinated. I'm not interested. Is there anything, in this conversation I'm having with her, is there anything I can do to answer any question or to convince you to get a vaccine? No. That's one. Another response was, I spent over 15 minutes sitting at a table with a group of ladies, and the one person in particular I was really going after, trying to provide all the information. It was playing whack-a-mole with the questions. Well, got this question, got this other question. Okay, at the end of 15, 20 minutes, would you like a vaccine? No. No. Wonderfully, there was a lady sitting next to her. She said, I would. Sign me up. The lady that initially said no, 2 weeks later, came in for a vaccine.
Exactly.
That's, we're not even at, we're at 58% statewide, 48% in Sacramento County. We're at 50%. Where are we and where are we going?
I think one of the things that we need to recognize that it's going to take time. Oftentimes we're dealing with people who are disenfranchised or have so many other things that they are worried about. They don't know if they're going to have rent for the next week. They don't know if they have food for their children. Maybe they're sleeping in a car. And maybe, the vaccine isn't the most important thing in their minds at that moment. But being able to work with them, being able to address the other needs that they have, and developing again that relationship, we can get to the point where more of them are accepting. But oftentimes we want to be able to do everything quick. You come in, set up your tent, and everyone will just line up.
Do we have, you said it's going to take time. Now, I understand. I mean, we're in May, or on the cusp of May, summer. I'm assuming the spread will tamp down, mimic flu, I guess.
Right.
Do we have time? I mean, it's not that we don't have an alternative. Folks will raise their hand and become vaccinated when they choose. But are we, if with this delay, this perpetual state of 50%, are we just, are we playing into the disease's hands, if you will?
Unfortunately, when we continue to have low vaccination rates, we continue to provide opportunity for the virus to transmit. And the more the virus transmits, because this is the nature of this virus, continues to mutate, meaning it changes, and it could become much more virulent, much worse, spread
Resistant,
much quicker, more
even?
resistant. Yes. So yes, we are running out of time, but also, like you said, there is no alternative. All we can do is continue to offer. All we can do is continue to provide opportunities for people to get vaccinated.
You mentioned you were kind, and I know I'm up against the clock now. But you mentioned the role CBOs, community-based organizations, have in this. Unpack that more. How can CBOs? What should CBOs be doing vis-a-vis county public health to move us to where we need to be?
And they've actually been doing this. One of the great things that has occurred as a result of us having to deal with or respond to this pandemic is being able to get the resources to provide to CBOs, because oftentimes CBOs have very little money to be able to do stuff. They already have their own services that they're providing, and in order to be able to expand that, they need resources. So with the money that we got for the response, we were able to contract with a lot of CBOs, working with Sierra Health Foundation and forming what they call the SAT Collab. And so they're providing not only the information, correct information. In some situations, they're actually going door to door, knocking and saying, hey, we need to sign you up. You need this. And in other situations, just meeting the needs of people that, for example, oftentimes there are people who are not able to isolate because they don't have the money, or if they don't go to work, they won't get paid. And so having the resources to be able to meet those needs. And that does soften people. And they're like, okay, I think this person really cares about me. They're not just here to reach a certain number, but they care about my life. And I think that's what is important and what will get people to understand that this is for their own good.
You mentioned community early on. One of the things that I've chided some of the health systems in the community, I said, if the first time you choose to engage community is wearing a lab coat and a syringe in your hand, then that's not a good introduction. Mm-hmm. So I look at this as, despite all of its trauma, doesn't begin to describe it, but everything associated with COVID-19 and the loss of life and the economic deprivation, all of that, I agree with you in terms of the potential opportunity to build on community,
yes,
the relations that have been established. My concern is, and hopefully you'll tell me it's misplaced, my concern is we're reaching a point of fatigue where people are saying, you know what? And I hear Dr. Fauci, he's like, you may be done with COVID. COVID will tell you when it's done.
Yes.
But people are reaching a point of fatigue. It's like, you know what? Whatever, if I catch the disease, fine. If I die, fine. It's like, you don't really understand what you're saying. But I hear that a lot.
Yes, and unfortunately, that's what's happened with wearing masks. They're still strongly recommended. But if you go outside, oftentimes when I go places like a grocery store, I'm the only one wearing one.
You will be. Pretty much guaranteed, you will be.
Right. But I think that's where we just need to continue, because we know that this is what works. So being able to provide the vaccine, and when people are ready to get vaccinated, that we're there. Because if we wrap up and leave, basically we're leaving it up to the virus to do what it wants. but it's a fight that we're continuing, and our fight is with the virus. So you don't stop until, the enemy is completely defeated. So,
Dr. Olivia Kasirye, I can't begin to say thank you enough for standing in the space you're standing. It's got to be incredibly hard. Thank you. Thank you for coming here and being a part of this conversation. And if I could extract from you a promise that in the coming weeks, months, you'll come back and speak with us again.
absolutely. If I can help, if there's anything that I can say that will help someone, I am willing to do it.
I appreciate it.
Thank you.
Thank you so much, Doctor.
Thanks for the invitation.